So hysteroscopy is examination of the uterine cavity. Hysteros is uterus, scopy is examination. Hysteroscopy is used to diagnose various conditions inside the cavity of the uterus, like endometrial polyps, a fibroid, or even when there is a misplaced coil, you can use hysteroscopy to identify the location of the coil and to remove the coil. Hysteroscopy generally is not a major surgery. Hysteroscopy is usually a day case procedure. Most hysteroscopies nowadays are performed in the outpatient setting. About 80% of women have a hysteroscopy in the outpatient setting without any anesthesia. Usually they are asked to take some painkillers like paracetamol or ibuprofen 2 hours before the procedure. It depends on where the hysteroscopy has been performed. If we are performing hysteroscopy in the outpatient setting, then as I said previously, analgesia is used in the form of paracetamol and ibuprofen 2 hours before the procedure. Sometimes we use local anesthesia in the form of an injection before the procedure. If we are doing an operative procedure like removal of a polyp or a fibroid, then usually this is done under general anesthetic. And this is a day case procedure where women come in, have the procedure, and they are discharged home the same day. Preparation for hysteroscopy is more psychological than physical. It depends on where the hysteroscopy has been performed. If you're having an outpatient procedure, please have something to eat before the procedure. Please bring somebody along with you for support. Please have some painkillers like paracetamol or ibuprofen 2 hours before the procedure. If the procedure is done under general anesthetic, then you would have a preoperative check a few days before the procedure. You would be expected to bring in somebody because you would feel drowsy after the procedure, and it would be helpful to have somebody to escort you home. But generally, these are short procedures, and you are able to go home the same day. Some amount of bleeding and discharge is extremely common for the first 7 to 10 days after hysteroscopy. Usually the vaginal discharge is a watery vaginal discharge, which is pinkish or mixed with blood. This is extremely common. If there is an operative procedure done, for example, removal of a large endometrial polyp or a fibroid, then the discharge can last for up to 4 to 6 weeks. And it is anticipated that there will be some pain, some crampy pain similar to periods for the first 48 to 72 hours. I often say to my patients after an operative procedure to take some regular painkillers for the first 2 to 3 days at least, and to keep an eye on discharge which is other than pinkish watery, because that can be signs of infection.